And next, Professor Sarah Irfan Habib from Dhaka University. Thank you, Professor Habib.
First of all, thank you very much for giving me the opportunity to say something about the presentations. And I feel honored to be here to make some comments on 4 valuable presentations. I'm just going to give a free lunch comments on the 4 presentations. Fortunately, 3 of the presenters are known to me as a colleague. So I will go one by one. First of all, Professor Imtiaz, he has been a founding director of the Center of Genocide Studies in Bangladesh. And he has done lots of academic and intellectual works, particularly in the history of emergence of Bangladesh. I congratulate him because he has taken an initiative to make a mapping of social variables which are directly related to COVID pandemic. So being a faculty of international relations, he has done some work on health sociology, obviously. And the variables he has identified, such as protest, rumors, penalty, fear, domestic violence, sexual assault, these variables very much fit with the area of health sociology. The thing is, in Bangladesh, we have faced lots of challenges due to COVID pandemic. The main reason was we had lack of preparations and we had ineffective healthcare planning to deal with this pandemic. Also, in Bangladesh, we have shortage of hospitals, healthcare capacity, lack of effective coordination among government policymakers. So he has identified those things. The basic issue is the COVID-19 has given us some directions to do more research in the area of sociology of health. For example, whether the governments have the economic and institutional capacities to handle such a pandemic. So this is a vital question. And this pandemic actually forces us to think about the reimagination of the concept of social. In this health session, we had lots of discussions, critical discussions, and some of the questions were very much powerful. I would say the questions are more powerful than COVID-19, but it is very difficult to answer in a shortcut way. One of the basic problems we see is the issue of medical socialization of physicians and frontline health workers. This is a big challenge in Bangladesh, and I would say this is a challenge for other countries as well. How to handle patients in this critical situation. Although a medical doctor or a healthcare worker has got some kinds of training in a medical setting, but COVID-19 has taught us the different kinds of dynamics and challenges. So medical socialization is very important. Unfortunately, in Bangladesh, as well as in other medical institutions, health sociology and medical sociology is not being taught. As a result of that, the mind setup and framework is very much confined and concentrated on virology, immunology, bacteriology. But COVID-19 is more than biology. This is very much important. And sociology has got lots of things to do. The second presenter, Dr. Zakia Hussain, she has made some valuable reviews in relation to social inequality in the context of Australia and United Kingdom. Mostly, she did some research on the culturally diverse groups in Sydney and found that these groups, these minority groups, their experiences or challenges are quite different. Obviously, social inequality is one of the factors, but minimizing the gap of social inequality is not the solution. There are lots of other issues. And one of the basic questions is whether it's the effect of biology or it is the effect of culture or it is the effect of social issues. Whether the genetic components of these migrant groups can make people more vulnerable, or whether the cultural patterns, lifestyles, and the structural barriers play a vital role for the vulnerability. And it is the question of agency and structure as well. So evidence has suggested that social inequality exists in the United Kingdom. It exists in Australia. It exists in the United States of America as well. And we have to look at the housing condition, the occupational risk, and the access of healthcare. So the basic issue is the richest societies or the richest countries in this world may not have the best healthcare system. And America is the best example. And COVID-19 has taught us that your per capita GDP is not the solution. The solution is how you handle this situation. What is your priority? So this is a nice presentation, I would say, in the context of Australia. And this is a presentation about the social and cultural factors. And as we know, many of the migrant groups, minority groups, they have other health problems as well, particularly the Asian people in the United Kingdom, the Afro-Americans, they suffer from chronic diseases, particularly coronary heart disease, hypertension. These are very much common among this ethnic group. So scientists, they are suggesting that whether these comorbidities were responsible for the high mortality during the COVID pandemic. The third presenter, Professor Habibul Haq Khandokar, he is a very renowned sociologist and he has been working in the area of globalization. He used to teach in Singapore National University. He made lots of valuable comments, and I'm happy to know that he has been working in the area of health as well. Sociology has many things to do with COVID-19. Particularly sociology and public health share many of the concerns in the study of social and cultural factors that actually affect health. Although sociology and public health have different approaches, methodological procedures, conceptualizations, as well as measurement and research designs, but often they serve for collaboration between the two disciplines. We are living in a situation in which we no longer predict or control the virus. There will be re-emergence of infectious diseases, and plague is the best example. As you can see, plague re-emerged in Bombay in the mid-90s. So COVID-19 is not the end in human society. One sociologist, Beck, has suggested that we are now facing the unintended consequences of industrial modernity. This was discussed in his famous book, Risk Society Towards a New Modernity. So there are lots of discourses of risk related to COVID-19, and this can be discussed in relation to the key concepts of sociology, such as risk, globalization, multinational cooperation, our consumption patterns, international trade, and health education as well. And some of the presenters, they have actually covered those issues. So public health and sociology actually share many of the same boundaries. Public health has got two focuses. One is the broad focus and the other one is the narrow focus. The broad focus actually addresses the structural issues, the socio-cultural foundations of health, in which sociology and public health are interrelated, in which sociology can work with COVID-19. The other one is the narrow approach, which actually focuses on the proximal risk factors, such as our lifestyle, our hand washing, the mask issues, social distancing, our risk behavior. So the structural issues can be done in a collaborative manner. So this is the area where sociology and public health can actually work. In many of the countries, we have seen that the healthcare system actually depends on the powerful interest of the politicians. As I have mentioned, that public health activities, these are actually not carried out in a social vacuum. They are subject to the powerful interest and the political economy of many countries, and Professor Khondokar has mentioned that. And public health has a long history of concerns with access and equity, and it is possessed with social justice dimension throughout the human history. So the basic issue is equity, accessibility, our appropriateness, our empowerment, integration of health services.
Thank you very much. Thank you, Professor Sarah. So it's almost the time. I'm really appreciate your discussion. And again, thank you very much for all presenters and discussants for your excellent participation. What a wonderful session. All countries are responding to COVID-19 in various ways and working for international coordination. In addition to medical care, we are also trying to respond to the pandemic in the area of politics, economics, and media. In this context, contribution from sociology, such as those discussed in this session. This is also very important. I hope you will make use of what you have learned through this session in your own country in the future. Thank you again for your participation.